Now students, so this is basically combined MCQs part 2, and in this again there are around 112 MCQs which we are going to discuss. And starting from the first part 2 ka first part, question number 1. Which of the following statements is incorrect regarding Samter's triad? It is only triggered by aspirin. See, understand they are asking which of the following statements is incorrect. It is only triggered by aspirin. Other NSAIDs with COX-1 blocking ability can also trigger, characterized by asthma, nasal polyps and aspirin sensitivity, and it involves overproduction of leukotrienes. So now let us understand what Samter's triad is. Samter's triad is basically aspirin exacerbated respiratory disease. So this is also called as AERD. And this triad is a chronic condition and it has got 3 clinical features. First is asthma, then second is polyps, and third is sensitivity to all NSAIDs and not just aspirin. So it involves overproduction of leukotrienes. Yes, that is the basically underlying mechanism, characterized by asthma, nasal polyps and aspirin sensitivity. Yes, other NSAIDs can also produce these symptoms. Yes, and it is only triggered by aspirin. So this is the wrong answer here. So the answer which we have to mark as they're asking incorrect is this. Next, aprepitant, a drug which is used to prevent late onset. Aprepitant, a drug used to prevent late onset chemotherapy-induced nausea and vomiting, acts through which of the following mechanisms? Now, options given are NK1 antagonist, NK1 agonist, NK3 antagonist, and NK2 antagonist. The right answer here is NK1 antagonist. Aprepitant blocks the activity of substance P at NK1 receptors, okay, in the brain. So this is the activity of aprepitant, and this is approved by US FDA. For prevention of nausea and vomiting with other emetics in patients with cancer chemotherapy, right? A pregnant woman with a history of bronchial asthma is in the 3rd stage of labor, right? History of bronchial asthma. Which drug should be avoided in managing postpartum hemorrhage in this patient? Now, which drug should be avoided in managing the PPH? Out of the options, carboprost, oxytocin, dinoprostone, and methylergotamine. Now, out of all these agents, oxytocin can be given in this patient, dinoprostone can be given, methylergometrin, and carboprost. Carboprost is a prostaglandin analog. So, prostaglandin PGF2 alpha analog hai ye, and using this will induce bronchospasm. So, now this bronchospasm can be life-threatening in asthmatics, in patients with asthma. So, in this patient, the drug to be avoided is carboprost. A bronchial asthma patient on inhalational steroids presents with white lesions on the tongue and buccal mucosa. What is the drug that can be used to treat this condition? So now the white patchy lesions on the tongue and buccal mucosa, they are indicative of oral thrush, that is candidiasis. And so in these patients, we need to give an antifungal agent, which is clotrimazole in this case. Greaseprevir is not given. This is given in systemic fungal infection. Terbinafine, flucytosine also cannot be given in this. The patient can be given clotrimazole, and that is the best treatment in these infections. A male patient with chronic obstructive pulmonary disease, okay, was prescribed theophylline. He noticed that his urine output has increased. This action of drug is mediated through which of the following receptors? Now theophylline basically acts via 2 receptors, that is, it inhibits phosphodiesterase 4 and it also inhibits adenosine receptors. So by this adenosine receptors के through जो इसकी action mediated होती है, that is on the kidneys and the CNS. So adenosine, the kidneys and CNS पे adenosine से होता है, PD4 CVS पे, and lungs पे जो इनका bronchus पे action है वो इससे होता है PD4 से. So the action is mediated through the adenosine A1 receptor. So this we know, we have discussed, and adenosine receptors, they are involved in the regulation of water and electrolyte balance in these patients. Which one of the following substances acts as a suppressor of DNA synthesis? DNA synthesis का suppression कौन करता है? The options given are 6-MP, 6-mercaptopurine, mitomycin, actinomycin, and asparaginase. Now here the names are very much indicative, very much clear also that what are these drugs. 6-mercaptopurine is basically an anti-cancer agent, and this drug, it is administered orally. It is a prodrug and it is metabolized by hypoxanthine guanine phosphoribosyl transferase to form 6-thioguanine nucleotide. And these nucleotides, they then integrate with DNA and RNA, and they lead to the arrest of DNA replication, and thus they cause cytotoxicity. So the answer to this question is suppression of DNA synthesis by 6-mercaptopurine. A patient on lithium developed hypertension. He was started on thiazides for hypertension. After a few days, he developed coarse tremors and other symptoms suggestive of lithium toxicity. Now explain the mechanism. Now lithium, you should understand that lithium has a very narrow therapeutic index, and the moment any drug induces or inhibits its metabolism, then it can result in toxicity. So the options given here are lithium, thiazide inhibit the metabolism of lithium, thiazide acts as an add-on drug to lithium, thiazide increase the tubular resorption of lithium, thiazide cause water loss, thereby increasing lithium levels. Lithium is eliminated from the kidneys. Okay, it is excreted, eliminated, we can say, by the kidneys. Now when you give thiazides with the lithium, thiazides अगर आप start करोगे patient के, तो thiazides what they'll do is they'll increase the tubular reabsorption or resorption of lithium, right? As a result, they'll increase the plasma concentration of lithium, and this will result in toxicity. So this toxicity will present as coarse tremors and GI disturbances, etc. So what is the right answer? The right answer is thiazides, they increase the tubular resorption of lithium. Next question is, which of the following medications should not be recommended in conjunction with theophylline? Now we know that theophylline, we know it is basically a phosphodiesterase 4 inhibitor, and it is used in asthma. And theophylline is metabolized by CYP3A4 enzyme. And now if you give, there are certain drugs which increase or inhibit this enzyme, right? So out of this, erythromycin, cefotaxime, cotrimoxazole and amoxicillin, erythromycin is basically an inhibitor. It inhibits this enzyme. So because theophylline, erythromycin inhibits the enzyme, so that will result in increased level of theophylline in the blood, and that will increase the toxicity of theophylline, right? So which medication should not be recommended? That is erythromycin. Next, which drug amongst the options has a tendency to accumulate in the cornea? It's a very simple question. Leflunomide, chloroquine, methotrexate, sulfasalazine. All these drugs are used in rheumatoid arthritis. And in rheumatoid arthritis, which drug has a tendency to deposit in the cornea? That is chloroquine. Chloroquine has a tendency to deposit in the eye. It gets deposited in the cornea. It also gets deposited in the retina and causes retinopathy. So this drug has a tendency. Which of the following drugs is not likely to cause pulmonary fibrosis? The options given are metformin, methylsergide, bleomycin, nitrofurantoin. Now the drug which does not cause pulmonary fibrosis is very clear here. See, methylsergide and bleomycin, nitrofurantoin, they all cause pulmonary fibrosis. Metformin is an anti-diabetic drug, and the side effects which are associated with it are usually nausea, vomiting, diarrhea and lactic acidosis. That is also more common with fenformin and vitamin B12 deficiency, right? So it does not cause pulmonary fibrosis, so that is the correct answer here. Next, which of the following statements is true regarding the dose response curve shown in the image below? Now you can see the dose response curve here. Now this is drug A, this is drug B, this is the log dose response curve, and this is the drug C. Okay, so drug A, drug B and drug C. So now what are the options? C is competitive antagonist, C is more potent than A, B is more potent than A, and B is competitive antagonist. Now let's see them one by one. Remember, in quantal dose response curves, the competitive antagonist जब होता है तो it causes a rightward shift of the curve, and if it is a non-competitive antagonist, then it causes a flattening. Okay, flattening of the curve. So these are the two things. So now A is the drug, B there is a rightward shift, so B is a competitive antagonist. So C is competitive, no, C is a non-competitive because there is a flattening. So this is wrong. C is more potent than A, no. Now potency, again potency is defined by the position of the curve on the log dose response graph, and efficacy is shown by the height. Okay, so this, as the drug moves rightward, the potency decreases. So drug A is more potent than drug B, and if there's flattening, then drug B is more efficacious than drug C. So now C is more potent than A, no, not at all. C is not potent. B is more potent than A, no, it is less potent. B is competitive antagonist. So this option is correct. A competitive antagonist, as I told you, there's a rightward shift of the curve. Which of the following anti-glaucoma medications is unsafe in infants? Now the anti-glaucoma medication which is unsafe in infant is brimonidine. Brimonidine is known to cause respiratory apnea in infants. So as a result, this drug is contraindicated in infants if they are having glaucoma. Timolol can be given, latanoprost given, dorzolamide is also given. The apparent volume of distribution of a drug is very high, that is 6 liter per kg. Which of the following is true regarding the distribution of that drug? So when the volume is very high, that means the drug is basically distributed widely. इसका distribution पूरी body में हुआ है ना? जब volume of distribution बहुत ज़्यादा आ रही है, that means वो drug पूरी body में distribute हुई है. So पूरी body में distribute होने के लिए, what is the true? Highly bound to plasma protein? No. If it is highly bound, then it will remain in plasma, and then its VD will be less. Confined to vascular compartment? No. Then also the VD will be less. Sequestrated in body tissues? Yes. So a high volume of distribution means the drug is distributed extensively beyond the vascular compartment and is sequestrated in the body tissues, distributed throughout the body. Which phase of clinical trial is primarily focused on assessing the preliminary efficacy and determining the optimal dose of the drug? So the phase of clinical trial which basically focuses on the efficacy is phase 2. Phase 1 is mainly safety study and to find out the minimum effective dose and maximum tolerable dose, right? Phase 2 is a study in which efficacy is tested, efficacy along with safety is tested on a limited number of patients. Okay, and this phase 1 is done in healthy volunteers. That is the difference. Phase 3 is done on large number of patients, and phase 4 is post-marketing surveillance. Okay. What is the drug of choice for diphtheria carrier state? Amoxicillin, erythromycin, rifampicin or tetracycline? So diphtheria carriers में erythromycin is the drug of choice for diphtheria carriers, and it is effective against bacterium. It is typically used to prevent the spread of the disease to treat the carriers. Tetracycline, rifampicin, amoxicillin, they are not used in diphtheria carrier state. Which of the following medications is most commonly used for maintenance therapy in opioid withdrawal? Now, opioid withdrawal की maintenance therapy में what are the options? Buprenorphine, naloxone, naltrexone, acamprosate. Now, acamprosate is used in alcohol withdrawal. So, acamprosate को हमने सीधा सीधा यहाँ से हटा दिया. मतलब alcohol withdrawal या बोलो alcohol जो छोड़ना चाहते हैं उन patients में दिया जाता है alcohol dependence में. Now, we have naltrexone, naloxone. So, these are basically antagonist. Okay, antagonist of opioid, morphine. तो antagonist को अगर हम opioid withdrawal में देंगे तो वो तो फिर और ज़्यादा symptoms को aggravate करेगा. So, the drug which is given is buprenorphine. Now, buprenorphine is a partial agonist at the mu receptor and it is used in the maintenance therapy of opioid withdrawal or opioid dependence. Now, basically क्या होता है? It manages the withdrawal symptoms and it also reduces the cravings. Okay, and basically has a ceiling effect. What is the benefit of this drug is that it has a ceiling effect. So it reduces the risk of misuse. It also reduces the risk of respiratory depression and reduces the risk of overdose. So that is why buprenorphine is preferred in maintenance therapy. It can be combined with naloxone to further deter the misuse. So it is a very effective drug in maintenance therapy of opioid withdrawal. A hypertensive patient stopped antihypertensive medication due to dry eyes, dry mouth and constipation. Okay, so patient को dry eyes, dry mouth और constipation हो रहा था जिसके कारण उसने medicine छोड़ दी. After stopping the drug, he developed hypertensive emergency. That means BP became more than 180 by 120. So what is the most likely drug? Options are clonidine, lisinopril, amlodipine and telmisartan. Now, out of these options, clonidine is the drug. Clonidine is a very, very favorite drug of examiners. So, clonidine को जैसे ही आप stop करोगे, it will precipitate withdrawal. So, इसका withdrawal होता है और ये करती है hypertensive emergency precipitate. ठीक है. Now, clonidine कैसे act करती है? It acts on alpha-2 receptors. And alpha-2 receptors are basically autoreceptors. And by autoreceptors, we mean that they basically decrease the central sympathetic outflow. And that is their mechanism of reducing the blood pressure. Now, when you stop this clonidine abruptly, it will lead to a rebound increase in blood pressure. Why? Because there is supersensitivity to noradrenaline has developed, because we have suppressed the central sympathetic outflow for such a long time that the other receptors all over the body become very supersensitive. So as soon as you remove this removal of this inhibition will result in a high blood pressure causing emergency. Now, dry eyes, dry mouth, constipation, they are side effects of clonidine. So clonidine withdrawal will result in this kind of hypertension. Example of SNRI, antidepressant. Now, what is SNRI? SNRI is basically a selective norepinephrine reuptake inhibitor, right? And it is used as an antidepressant. Now, what is the drug here? Tramadol, no. Bupropion bhi nahi. Paroxetine, reboxetine में से the drug which is an SNRI is reboxetine. So here the right answer is reboxetine. Drug used for HIV-induced lipodystrophy. So what is the drug used in HIV-induced lipodystrophy? What are the options given here? Tesamorelin, somatropin, octreotide and pegvisomant. Now, somatropin, octreotide and pegvisomant, these are the anti-growth hormone antagonist hain, growth hormone inhibitors hain. What is the drug? Tesamorelin. Tesamorelin is a synthetic growth hormone releasing hormone analog. It is a growth hormone releasing hormone analog, right? Now, this is specifically used in reducing abdominal fat in patients with HIV associated lipodystrophy. So this basically increases the release of growth hormone and reduces the visceral fat accumulation. Okay. So this is the primary medication approved for this indication. A 48-year-old man with a history of chronic gout presented with recurrent episodes of painful attack despite being on allopurinol. His physician suggests a drug that inhibits the reabsorption of uric acid in the proximal tubule. Which of the following drugs uses this mechanism of action? So it is a very simple question. Patient है allopurinol पे पर फिर भी उसे recurrent episodes आ रहे हैं. So a drug that inhibits the reabsorption of uric acid in the proximal tubule. So out of these drugs, probenecid, febuxostate, raspberry and colchicine. So probenecid is the drug that reduces the reabsorption of uric acid in the proximal tubule. It increases the excretion of the uric acid in the kidney. Febuxostate is an xanthine oxidase inhibitor, so this drug does not act through this mechanism. Colchicine, raspberry case basically is a recombinant form of urate oxidase enzyme, which is used to treat hyperuricemia following chemotherapy. Because when the patients of cancer are given chemotherapy for leukemias and lymphomas, then they are seen, non-Hodgkin's lymphoma, then they are seen to develop hyperuricemia. So in that case, raspberry case is used. So anyways, the answer here is probenecid. Up next question. A patient with renal insufficiency presented with very low renal urine output, pedal edema, headache and BP of 160 by 90. So he has blood pressure, renal insufficiency. Which antihypertensive can be administered? Now, aliskiren is a is a renin inhibitor, so aliskiren will not be used in this case because already there's renal insufficiency. Then patient is also having pedal edema, urine output become a headache. Chlorothalidone is a thiazide, amlodipine and prazosin. Now see, whenever there is a case of patient with renal insufficiency and urine output कम है, BP ज़्यादा है, ये सब है, तो सबसे पहले the first choice of drug is ACE inhibitor or ARB. They are the first line antihypertensive agents, particularly when there is proteinuria. Right? Now, in this question, we don't have an ACE inhibitor or ARB. Second choice drug is CCB. Then we have loop diuretics also, third choice. So now, out of the given options, we have CCB here, that is amlodipine. So we're going to use this. Alpha blockers are not used in renal insufficiency patients. Chlorothalidone is a thiazide diuretic, and this is also in severe renal insufficiency, it is not used. Next question is, a patient with hyperkalemia and elevated urea levels underwent dialysis. Towards the end of the session, she became drowsy and had a sudden seizure episode. On examination, this patient was hypertensive. Now, what is the treatment for this condition? Out of the options, bumetanide, ethylchronic acid, nesiritide, IV mannitol. Now, this treatment, this situation, it looks like a dialysis disequilibrium syndrome. Before dialysis, she had increased urea. Now, after dialysis, the urea decreased, and this resulted in osmotic, a very high osmotic gradient between the blood and the brain. And that was the reason why this patient went into drowsy and seizures. So DDS को नहीं हो उसके लिए क्या होता है? Reduce the clearance, do it slowly, increase the time over which the clearance is performed, and add another osmotically active substance like mannitol. Because we are removing urea, so you need to add some osmotically active substance which will not change the plasma osmolality significantly. Not change the plasma osmolality significantly. So this is the option which has to be marked here. Which of the following is an oral factor 10A inhibitor? The options given are bivalirudine, dabigatran, rivaroxaban and enoxaparin. Now, oral factor 10A inhibitor is rivaroxaban. Dabigatran, bivalirudine are direct thrombin inhibitors. Okay, rivaroxaban, apixaban, they are the drugs which inhibit factor 10A, and enoxaparin is actually a low molecular weight heparin, right? What is the mechanism of action of oseltamivir and zanamivir? Oseltamivir and zanamivir are drugs basically used in the treatment of influenza, and these drugs, they act by neuraminidase inhibition. So viral neuraminidase enzyme को inhibit करती हैं, and they bring the action in influenza. Which drug is used in the maintenance phase of opioid withdrawal? Again, similar type of question we have done earlier: buprenorphine, disulfiram, butarphenol and clonidine. Now, in this maintenance phase of opioid withdrawal, we use buprenorphine as it is a partial agonist at the opioid receptors, and so it reduces the cravings also, and it also reduces the withdrawal symptoms. Okay. Disulfiram is basically a drug which is used in alcoholic dependence में use करते हैं. Clonidine is used to reduce the anxiety, agitation, muscle ache, sweating, but it does not affect the cravings. So it does not have any effect on the drug craving. Naltrexone is another drug. Naltrexone and naloxone, they are basically opioid antagonist. So they prevent the relapse, and they can be combined with buprenorphine also for a better effect. Another drug is there, methadone. So methadone also, it is helpful in helps with detox. That is, it relieves the withdrawal symptoms. So methadone is another drug which can be used. Then it is also used, methadone is also used for long-term maintenance medication on for opioid dependence, maintenance of opioid dependence, right? After a period of maintenance, then dose may be reduced over a period of time, and this helps in the withdrawal of opioids. An example of bacteriostatic drug is aminoglycoside, vancomycin, metronidazole and linezolid. Now, aminoglycoside is a drug which acts on usually the gram-negative and anaerobes, and it is also bactericidal. Vancomycin is bactericidal. Metronidazole is bactericidal. The drug which is bacteriostatic is linezolid. Linezolid is an oxazolidone antimicrobial drug, and it is indicated in gram-positive infections, skin and other like pneumonitis and vancomycin-resistant enterococcal infections also it can be used, but it is bacteriostatic. A female patient presents to you with a unilateral headache. It is associated with nausea, photophobia and phonophobia. What is the drug of choice for acute management? So female patient with a unilateral headache indicates that this is a case of migraine, and in migraine, now this is an acute attack. So see, acute management में sumatriptan. Sumatriptan is the drug of choice. It is a 5-HT 1B 1D agonist, and by its action it causes vasoconstriction and relieves the blood pressure, relieves the migraine. Flunarizine, propranolol and topiramate, these three drugs are used in chronic prophylaxis. Okay, so chronic prophylaxis of migraine may we use flunarizine, which is a weak calcium blocker, propranolol, which is a beta blocker, and topiramate, which is an anti-epileptic and is very found to be effective in migraine also. A 7-year-old boy presents with abdominal pain, vomiting, oliguria, and periorbital puffiness following chemotherapy. Okay, investigations reveal hyperuricemia, raised creatinine, and hyperkalemia. What is the next best step in the management? Now, patient has oliguria, hyperuricemia, raised creatinine, hyperkalemia after chemotherapy. So how will you manage this condition? Now, in this case, the first thing that needs to be done is hydration. You will feel इसमें raspberry case देना चाहिए, उसका uric acid निकालना है. But the first thing that you have to do is hydration. So these symptoms that the patient is presenting with are very much indicative of condition which is known as tumor lysis syndrome, which is a complication of chemotherapy, right? Complication of chemotherapy होने के कारण patient में ये problem आई है. Now in this case you give hydration and you address the oliguria first, address oliguria and puffiness. And once the hydration becomes better, then the patient's situation becomes better. A 25-year-old male presents to the clinic with complaint of feeling of insects crawling under the skin. Which of the following drug abuse can cause the symptoms? Feeling of insects crawling under the skin. Cannabis, cocaine, amphetamine, alcohol. Now this thing is called as formication. Formication is the sensation that bugs are traveling on or under your skin. And causes of formication are mental illnesses, psychosis, certain medications like prescriptions like drugs, antipsychotics or drug use or Parkinson's. These are the conditions. Cocaine and methamphetamine, they also make it feel like bugs are crawling. So the right answer here is cocaine. Which of the following drugs is used as an anti-smoking agents? Anti-smoking के ऊपर अपने बहुत बार same type of questions आते हैं. So busulfan, acamprosate, varenicline, gabapentin. Now remember, acamprosate is used in alcoholic dependence. Varenicline, busulfan is an anti-anxiety which is used in smokers. Gabapentin again the same mechanism, but the drug which is actually reducing the smoking, it is an alpha 4 beta 2 agonist at which receptor? Nicotinic receptors. So this is the action by it, and it is a partial agonist, right? So by acting on this receptor, varenicline reduces the cravings and reduces the smoking addiction. Okay, so the right answer here is varenicline. A 6-month-old infant is brought up due to concerns about episodes of sudden repetitive muscle contractions involving arm and legs. An EEG reveals a hips arrhythmia pattern. Genetic testing reveals mutation in the TSC gene. What is TSC gene? TSC gene is tuberous sclerosis gene. Right? So which of the following is the drug of choice in this condition? Now remember, this infant is having infantile spasms and EEG shows that these are hips arrhythmia pattern. Now these spasms are associated with the condition called as tuberous sclerosis. So if the patient is having infantile spasms with tuberous sclerosis, then the drug of choice is vigabatrin. Okay? And if it is infantile spasms without tuberous sclerosis, then it is ACTH. Remember this. So the answer here is vigabatrin. Which of the following interleukin is inhibited by tocilizumab? ये बहुत simple question है, आप सबको आता है. Tocilizumab was the drug used in COVID also very famously, and this basically reduces. It is a biological drug used against interleukin 6 receptors. Tocilizumab is a monoclonal antibody against interleukin 6 receptors, and this drug is administered intravenously or subcutaneously. It is also used in rheumatoid arthritis and other sickle cell arthritis, juvenile idiopathic arthritis, cytokine release syndrome. A 63-year-old male with a history of coronary artery disease presents to the clinic with worsening chest pain during physical exertion. The cardiologist performs a pharmacological stress test, and during this test, the patient symptoms were exacerbated. So, what was the drug? Which of the following drugs is not associated? So, drugs given are adenosine, dipyridinol, nitroglycerin, and nitrotocide. Now, this is a coronary steal phenomena, right? When a drug is given and it exacerbates the ischemic symptoms. Now, coronary steal phenomenon, एडेनोसिन, डायपिराडिनोल, नाइट्रोग्लिसरिन, नाइट्रोटोक्साइड, इनमें से कौन सी ड्रग है जो बिल्कुल नहीं करेगी? क्योंकि हमें पूछा गया है which drug is not associated. So nitroglycerin is the drug which will never do a coronary steal phenomenon because it is primarily a vasodilator and it acts on the coronary arteries and increases the causes smooth muscle relaxation and increases the diameter. So nitroglycerin does not cause coronary steal phenomenon, and right answer is that. A 58-year-old patient, female patient with a history of atrial fibrillation, visits for routine follow-up. She has been prescribed an antiplatelet drug to reduce her risk of stroke. Her medication includes clopidogrel, which she has been taking for past 6 months without any adverse effect. Now, which receptor is targeted by clopidogrel? Very simple question. Now, clopidogrel targets the P2Y12 receptor. Clopidogrel is a prodrug and जो उसका active metabolite होता है, which is produced after metabolism. This acts irreversibly. Irreversibly, it binds to the P2Y12 ADP receptors on platelets, right? So this is the action of this drug, and this binding prevents the ADP binding to the receptors, activation of glycoprotein GP2B3A, and platelet aggregation, right? Next, a 65-year-old patient presents with severe hyperkalemia. Serum potassium is 6.5 milliequivalent per liter. The healthcare team decides to administer insulin to lower the potassium levels. So which mechanism explains how insulin contributes to the management of hyperkalemia? So insulin basically और more effectively glucose insulin अगर साथ में देते हैं तो then it stimulates the potassium uptake into the cells via the sodium potassium. It does not enhance the potassium excretion, does not inhibit potassium release, does not increase the potassium absorption. It stimulates the potassium uptake into the cells via sodium potassium ATPase pump. Okay. A patient who is on treatment for angina presents to you with erectile dysfunction. You decide against prescribing sildenafil because the patient is being treated with. Now, what is sildenafil? So sildenafil is a phosphodiesterase 4 inhibitor, and by acting on this, it basically causes vasodilatation, right? It increases cyclic AMP and causes vasodilatation. Now, vasodilatation will reduce the blood pressure, and the patient is being treated with CCB, beta blocker, nitrates, or ACE inhibitors. So here, nitrates ke saath sildenafil is contraindicated because nitrates also cause vasodilatation and cause a reduce in BP. So if you combine both the drugs together, then it will result in a very significant fall in the blood pressure, and patient can develop hypotension also. A female patient presents to the emergency department with severe restlessness, palpitations, tremors. She is a known case of bronchial asthma. On examination, the neck looks swollen, the blood pressure is elevated, and tachycardia is noted. ECG shows AF. Which of the following drugs is used for immediate management in this patient? Now, this is a patient of atrial fibrillation. Okay. Now, medication has to be given to control the heart rate and the rhythm. Right. Now, beta blockers and calcium channel blockers and CCBs, they are the common choices for rate control. So what are the options given here? Diltiazem, propranolol, esmolol, and propylthiouracil. So propylthiouracil to thyroid anti-thyroid drug है तो कट हो गया. Esmolol is a very short acting drug, not used here. Now propranolol and diltiazem. So इसमें से the drug which we will be giving in AF is diltiazem. And she is a known case of bronchial asthma. That is why propranolol is not given, because propranolol will exacerbate bronchial asthma. A schizophrenic patient was prescribed drug A after he did not respond to haloperidol and thyroidazine. Now he presents with excessive salivation, an increase in blood glucose, and hyperlipidemia. So what is drug A? So initially he was not responding to typical antipsychotics, and so he is prescribed a new drug. Now that is ziprasidone, risperidone, clozapine, and aripiprazole. Now atypical antipsychotics दिए गए हैं, and atypical में कौन सी drug है जिसके ये side effects होते हैं? Excessive salivation, increase in glucose, and hyperlipidemia. They are basically seen with clozapine. So clozapine is the culprit here. Which of the following is the drug of choice for preoperative antibiotic prophylaxis in a patient undergoing cardiac surgery? Now, preoperative prophylaxis, patient for drug of choice for preoperative antibiotic prophylaxis in patient undergoing cardiac surgery. So, in patient undergoing cardiac surgery, we use cephalosporins, which is the option here is cefazolin. So, this is a first generation cephalosporin, penicillin, erythromycin, azithromycin, and cefazolin. So, isliye the drug of choice is this. Cefazolin is the right answer. Next question. Now, this question, as you can see, it is based on cytochrome P450 drugs. So match the following cytochrome P primary metabolite, that is CYP1A2, CYP2C9, CYP2C19, 2D6, and 3A4. And the matching has to be done to phenytoin, midazolam, clozapine, pantoprazole, and codeine. Right. Now, I can understand this is very difficult to remember even for me. I mean, I cannot remember them like this. So very difficult. And इस तरीके का क्वेश्चन आता है तो आप अगर completely sure हो तो ही आप लगाओ. चलो उसमें फिर भी try करते हैं कि 1, 2, 3, 4, 5. फेनेटोइन यूजुअली हमें पता होती है कि वो किससे मेटाबोलाइज होती है. फेनेटोइन एंड फेनेटोइन विद 2C9. Phenytoin gets metabolized by 2C9. So now the correct answer that they marked is 1C, 2A, 3D, 4E, and 5B. That is this one. Now 1C मतलब this matches clozapine से match कर रहा है. 2 is matching with this phenytoin. 3 is matching with pantoprazole. 4 is matching with E, codeine, and 5 is matching with midazolam. So this is the answer that they have given. What we can discuss here is like CYP1A2 enzyme metabolizes clozapine. CYP2C9 metabolizes phenytoin and warfarin. CYP2C19 metabolizes clopidogrel, right? Because and remember here that clopidogrel is basically a prodrug, so it is metabolized and its active metabolite is produced. Then we have azoles and the PPIs, that is omeprazole, pantoprazole. Azoles here are voriconazole, ketoconazole, right? Then CYP2D6 से आता है propranolol, quinidine, TCAs, SSRIs, codeine, and antipsychotics, right? Except clozapine. Clozapine ऊपर हो गया. Then we have CYP2E1. इससे होता है पैरासीटामोल. And CYP3A4. इससे होता है थियोफाइलिन, एस्टेमेजोल, मिडाजोलाम, साइक्लोस्पोरिन, diltiazem, OCPs, fexofenadine. So these are various important drugs that you should remember with this particular question. CYP1A2 से clozapine, 2C9 से phenytoin, warfarin, 2C19 से clopidogrel, azoles and proton pump inhibitors, CYP2D6 से propranolol, quinidine, TCA, SSRIs, codeine, antipsychotics except clozapine, 2E1 से paracetamol and 3A4 से theophylline, estomazole, midazolam, cyclosporin, diltiazem, OCPs, fexofenadine, tophylline. A patient of leprosy taking multi-drug therapy presents with worsening of existing lesions and nerve involvement. Now, what will be your next best step? Okay. So patient of leprosy है taking MDT, presents with worsening. What will be your next best step? Best step here will be to continue with MDT and start the systemic steroids. Whenever, now this is a lepra reaction, type 1 lepra reaction. Worsening of lesions, nerve involvement is because of leprosy reaction, because they are triggered by the inflammatory episodes due to immune system's response to the lepra infection. So corticosteroids will reduce the inflammation. So they will reduce the inflammation. You don't have to reduce the, you don't have to stop the MDT, continue MDT. A patient undergoing surgery is maintained on anesthesia with halothane. During the procedure, the patient suddenly developed hypothermia and muscle rigidity. So which of the following drug is most likely implicated? Now, this is malignant hypothermia because of halothane, and the treatment for malignant hypothermia is IV dantrolene. Remember that. And the drug which implicate is succinylcholine or succinylcholine. Okay, so this drug can be a triggering agent in along with halothane. A 10-year-old child weighing 30 kg presents with a history of loose stools for 2 days. On examination, there is severe dehydration. Laboratory investigations are as follows. So what is the initial management as per the ISPAD guidelines? Now, the patient, 10 साल का बच्चा है, उसको loose stools हुए, severe dehydration हुआ. Now, the test, they show that random blood sugar is very high. The random blood sugar is 550. pH is 7.01, means it is indicative of acidosis. And sodium ion is 158. And urine glucose is 3+, right? So that means there is glucosuria and glucose in the blood also. So now addressing the hyperglycemic, severe dehydration and electrolyte imbalance. So what will be the first step? What are the options? Manage ABC and normal saline 20 ml per kg and start insulin after 1 hour. Manage ABC NS 20 ml per kg along with insulin 0.1 international unit per kg. Manage ABC NS 10 ml along with insulin and manage ABC NS and start insulin after 1 hour. Now here the first thing is rapid rehydration and balancing the IV fluid and correction of the electrolyte management. So we have to give rapid IV fluid bolus, ongoing rehydration and hyperglycemia management. Start insulin after 1 hour. Let the initial rehydration therapy take place, and so it will clear the electrolyte imbalances, and then in children you have to start insulin after 1 hour. So this is the right answer here. A child before playing consumed fruit from the garden. After some time, he developed high fever, confusion, photophobia, and unable to urinate. So high fever ho gaya, photophobia ho gaya, and unable to urinate, which is indicative of atropine signs, atropine toxicity. So what are the likely causative agent and appropriate antidote? So Dhatura is the likely agent, and physostigmine is the antidote used in atropine poisoning. Right? So this is a very simple answer. इस तरीके के question में तो you should not do a mistake. In a village, it is observed that several farmers have crossed gate and use a stick for support to stand and walk. Due to poor yield of farms, they consume meals containing rice and pulses only. Supplementing their diet with which of the following vitamins can prevent this? Now, a very confusing question, because immediately your attention will go to vitamin D, that because they are having a gait problem. So you think because vitamin D is involved in managing bones. So vitamin D की तरफ हमारा इशारा एकदम से जाएगा क्योंकि bones की problem लगती है, लेकिन this is not the right answer. You see, they are consuming meals containing only rice and pulses. They are not eating any fruits. They are not eating any green leafy vegetables. So the deficiency here, the disease that we are trying to solve here is scurvy. And the deficiency for that is vitamin C. So this is the right answer. Now, as you know that there is an impaired collagen synthesis if there is a deficiency of vitamin C. So then it is important that we add this in their diet. A 20-year-old woman presents with breathlessness and chest pain. She is a known case of mitral stenosis. Her pulse is irregular. No thrombus is seen on echocardiography. So what is the best agent? Now, see, the very, very typical question. Here, a patient is there having breathlessness and chest pain, known case of mitral stenosis, and her pulse is irregular. So basically, this is a case again of atrial fibrillation, and the patient is having mitral stenosis. So a patient of atrial fibrillation with mitral stenosis, thrombus nahi hai. So the drug, the therapy which is the preferred choice is warfarin. So where is warfarin? This is oral warfarin is the therapy for patients with MS and atrial fibrillation as per the established guidelines. So this is warfarin is an anticoagulant which will be beneficial in this case. A pregnant woman at 36 weeks of gestation with a prosthetic valve replacement for mitral stenosis is on warfarin therapy. Now what is, her INR is 3, what is the appropriate next step? Now the patient is pregnant है, ठीक है, 36 weeks हो गई है. Now next step, 36 weeks पे plus mitral stenosis है, prosthetic valve replacement है, तो now we need to stop warfarin and we need to start with unfractionated heparin, right? Now, or low molecular weight heparin. Now, unfractionated low molecular weight heparin has to be started to maintain. Now, this is the answer here. So, stop warfarin and start LMWH, stop warfarin and start heparin. Continue warfarin, stop warfarin, start LMWH and aspirin. Aspirin we are not going to start because aspirin will have an effect on the ductus arteriosus. So, here stop warfarin and start with heparin. So, this is the treatment plan in this case. Which of the following drugs used as nail lacquer belongs to morpholines? Now, this is a very factual question. ऐसी चीजें normally कौन इतना इसमें concept कुछ होता नहीं है. So, the drug used as nail lacquer belongs to morpholine is amorolfin, and this is a drug which is used as an antifungal agent, and it is used as a nail lacquer. उसको cover कर लेता है and to treat the antifungal infections in nails, right? A patient is given a nicotinic receptor antagonist as a muscle relaxant. Now, which drug is given post-operatively? So nicotinic receptor antagonist is यहाँ पे D-tubocurarin, that is competitive antagonist at nicotinic receptor, or it can be pancuronium or opicuronium. So what drug is now given post-operatively to recover from the muscle weakness? The antidote to curares is neostigmine. Neostigmine will reverse the muscle weakness caused by the curares. Neostigmine is what? It is an acetylcholinesterase inhibitor. So it inhibits this enzyme and increases the acetylcholine activity. A person develops headache, breathlessness on a trekking expedition following a rapid ascent to over 3,000 meters above the sea level. Now, which of the following is not used for treatment in this condition? A person है ऊपर जा रहा है और उसको headache और breathlessness शुरू हुआ. What condition treatment will you not use? The question here they are asking is not used. Now, IV digoxin, immediate descent, administration of oxygen, tablet acetazolamide. Now, out of all the treatments, IV digoxin का यहाँ पे कुछ नहीं बनता है. This is not given. So this is patient of altitude sickness and इसमें the therapy which is given is hydration, administration of oxygen, descent करो, rest करो, pain relievers दो, acetazolamide start करो and you can give antiemetic steroids but digoxin नहीं देते हैं.